Hi, I'm Dr. Mary Stouter from Manchester West Veterinary Hospital. Today I'm going to talk about something new and exciting from Hill's Pet Foods. They have come up with a metabolic diet to encourage weight loss. Hill's, as we know, is a pioneer in the nutrition field with dogs and cats, and they are constantly updating and doing research. So they looked at some of their diet foods that they have that are currently on the market, RD, WD, the prescription diets, where they work and perhaps where they fail. And what they've come up with is this metabolic line of foods. Doesn't have initials, it's just metabolics. And what they have come up with is a brand new food. It's not a reformulation, using a lot of research, knowing that the nutrigenomics, working with the dog and cat's genome, has worked in the past, using certain foods and amino acids and combinations of foods to trigger the metabolism, then adding the particular ingredients and some new things to encourage the dogs to eat the food, the cats to enjoy the food, and to not have to measure and be ultra strict and exercise your dog 20 hours a day, and still get the weight loss. So they've come up with a very realistic, very friendly plan, and they worked in a number of factors. One is making sure that we get the correct goal weight. They have gone online and made up a program at their Hill's website that we log on to, and we enter in our patients, and then we measure them. They've come up with 4 measurements along with their weight, their breed, age, to adapt to what the dog should be. So it allows for the big bone dogs, the fluffy dogs, and such. So for example, what we're going to do with little Chloe here, and Kelly's helping me out, we're just going to make several measurements and we enter them into the computer, and I'll show you the printout that will come out later. Now Chloe is a nice sized little dachshund, but she's just such a convenient little girl to use. So one thing we do is measure their head length. So we go from between their eyes to the notch on the back of their head. So Chloe would measure about a 9. Then we measure around her head. And so we're about at a 25 centimeters. We measure her length of her forearm from her elbow all the way down to the top of her pad. We're going to measure to the top of the pad right there. And it's a little weird, they don't understand, so 11. And we measure her back leg, very similar. The heel, or tarsus here, down to the top of the pad, measures a 7. So we would enter those measurements into our computer program with our iPad, and we come up with a profile. This is a different patient, a Wheaton, but we get a profile. And what they figure out is exactly, based on those measurements, the weight, the breed, what this dog should weigh. And it gives us a body scale index, or body mass index. This is the percentage of body fat and how overweight they are. So this dog is reading in the 50% range. It is recommended that dog go down to 39 pounds from 59 pounds. So how do we do that? They actually give us a scale on how the recommended speed of weight loss. So it's a nice gradual. They recommend 0.7% weight loss a week. So a nice gradual weight loss. And then the next step is, of course, the diet choices. This we picked our metabolic diet. We can figure up how many cups, cans, even treats can be added in, so we get a universal coverage for them. It will tell us exactly how much to feed and how much the cost is per day, so we can realistically talk to you about how to feed your patient here. The next step is introducing the diet. It's very simple, like changing any food, a simple mixture, maybe a side-by-side, and we get the dogs eating it, and then we measure every month. We can measure weekly or monthly, depending how often you can bring your patient back in. But then each time you bring them in, we'll re-enter the measurement, maybe take some changes in the measurements and the weights, and put them in our computer program, and it will readjust, and we can keep track. So this is just really exciting. And we do have formulas for dogs and cats, canned, dry treats. These are the dog treats. We do have cat treats. So this is something I'm really quite excited about. We have started a number of patients on it. It seems like the dogs and the cats are accepting it well, and so far on the dog patients we have had weight loss, significant weight loss. Our kitty cats haven't come in because they don't like to ride in the car as much, but yes, we're definitely seeing some improvement. So if you think this can help out your pet, we'll be glad to talk to you about it. I'm Dr. Mary Stouter, Manchester West Veterinary Hospital. Thank you.